with these Medicaid cuts looming, 1 in 6 adults are having their insurance threatened, you know? Mm-hmm. And like losing that access to insurance could have long-term impacts on their health. They're less likely to want to go see doctor and would only seek care if it's like a dire emergency. There was like a House resolution bill for like budget reconciliation that kind of said that over $800 billion is going to be cut from Medicaid. We don't know if that's really certain right now, but House Republicans are discussing it. And that would be really crucial to states who depend on the federal government to fund their Medicaid program. And if states wanted to continue to fund these programs, they would have to find cuts in like their education programs within their own state budgets rather than depending on the federal government.
So you're saying that states, if they wanted to keep their Medicaid,
yes,
how it's currently running, they would have to cut elsewhere.
Exactly, yeah.
And that, I imagine that would have a lot of consequences on whatever they decide to cut to keep Medicaid. So it seems kind of like a lose-lose situation a little bit.
And alongside that, a lot of, these red states are also looking to implement work requirements that also limit eligibility, which would be ways to find cuts in their own Medicaid spending.
Oh, so work requirements. Can you elaborate a little bit on that?
Fun fact, actually, 92% of people on Medicaid actually do work, either work, caregivers, or students. So these work requirements are of this notion that people on Medicaid are kind of leeching off the federal government. Mm-hmm. And in all honesty, they're most likely to be used in future instances to reduce Medicaid eligibility. So they don't have to insure more people.